Prof. Thank you. Salam Sujatra, and a very good morning to everyone. I'm Ms. Kavita, lecturer at the Department of Nursing Science, Faculty of Medicine, University of Malaya. It gives me great pleasure to introduce the second speaker for today's session, that is Professor Winnie So. Professor Winnie So is a professor of the Natasol School of Nursing, the Chinese University of Hong Kong. She's also the president of International Society of Nurses in Cancer Care, the ex-president of Asian Oncology Nursing Society, and editor-chief of Asia Pacific Journal of Oncology Nursing. Recently, her Integrative Multicomponent Program for promoting South Asian cancer screening uptake impact was recognized by WHO Western Pacific Innovative Challenges as an innovative solution for various health challenges in the Western Pacific region. Without further delay, I would like to welcome Professor Winnie So to give her talk entitled Integrative Multi-Component Program for Promoting South Asian Cancer Screening Uptake Impact. Prof. Winnie, the floor is yours.
Okay, thank you. So thanks, Russell's kind introductions. So before I start, just want to double check with all of you. Can you hear me clearly?
We can hear you.
Okay, that will be great. Okay, so good morning, everyone. Okay, I'm very honored to participate in the Breakfast Health webinar series and share with all of you about an ongoing project, the program developed by me and my team. And thanks, Professor Chan's invitations. And the name of this program is the Integrative Multi-Component Program for Promoting South Asians Cancer Screening Uptake. And the title is pretty long. So in these presentations, I will use the abbreviations, the IMPACT program throughout my presentation. And actually, this program aims to reduce the cancer health disparity of the ethnic minorities in Hong Kong through improving their access to cancer screening services. Now, according to the Global Cancer Observatory, more than 19 million new cancer cases and more than 9.9 million cancer deaths were reported worldwide in 2020. And among those data, nearly 50% of the new cancer cases and more than half of the cancer deaths occurred in the Asia region. The United Nations is adopting a proposal in order to achieve a total of 17 Sustainable Development Goals by 2030. And one of them is the promotion of health and well-being of all people, which is being implemented by the WHO. Now, health disparities can be defined as a type of health difference that is closely associated with individuals being disadvantaged socially, economically, or environmentally, so that individuals with such disadvantages could have a poorer health status compared with those without these disadvantages. And these disadvantages can be due to various factors, such as poor socioeconomic status, geographical constraint, and having disabilities. In other words, health disparities are basically unfair and avoidable difference in health status between individuals. And in fact, disparities do exist in terms of the incidence and mortality of a number of lung diseases. And one of these is cancer. Now, as indicated by the data from the International Agency for Research on Cancer, so disparity exists across the countries and the regions. Now let us look at this diagram as an example. So while more developed, the Western countries such as Australia, New Zealand, and United States, and also the countries in Western and Northern Europe have a higher age standardized incidence of cancer, but low cancer mortality rate. And people in less developed countries such as Africa and Central South Asia are prone to lower cancer incidence but higher cancer mortality rate. A possible reason to explain having high incidence rate but low mortality rate in developed countries may be due to the promotions of cancer prevention and also the early detection of cancer. And more people are diagnosed with cancer in the precancerous stage or early stage of cancer, and with the timely and effective treatment can be received. However, people from less developed countries or the regions may seek for medical advice in their late stage of cancer. And also, the resources for the cancer screening, diagnosis, and treatment may be neither sufficient nor available. There are several factors that can contribute to differences to access the cancer care, such as education or the health literacy. And people with low health literacy often delay receiving cancer services. Other factors is related to the residence or the geographical restrictions. And for those who are living in the rural area, always face geographical restrictions in accessing cancer care. And also the limited access to cancer care services and inaccessibility also limit the accessibility to such services. Income levels. And income levels has a long-lasting impact on cancer screening inequality. And individuals with lower incomes are less likely to receive the services and may wait for longer for services. And last but not the least is ethnicity. And study regularly reported that the ethnic minorities have limited access to cancer care services. Now, similar situations of the limited accessibility of cancer care services among ethnic minority groups was found in Hong Kong. And actually, I and my research team conducted a studies in order to examine the uptake rate of the cancer screening test among the South Asians, which is the largest ethnic group in Hong Kong. And we found that the uptake of the cancer screening among the ethnic minority in Hong Kong was significantly lower than the general populations. And the barriers to access the screening services also identified, and they are lack of knowledge of the cancer screening and how it can be accessed, misconceptions on the cancer and the screening test, language barrier, and also the cultural related issues. So therefore, we developed the impact program, which focused on to address the barriers to the use of the cancer screening services by the ethnic minorities in Hong Kong in order through the improvement of the accessibility to the cancer screening services. Now, actually, this impact program composed of various projects, and in these presentations, I selected 3 of them for sharing. Now, the first one is the multimedia educational interventions. And for these interventions, various health information dissemination methods was adopted, including the health talk, health information booklets, and also the video clips. And the South Asian language with the culturally relevant image and graphics were used in order to prepare the educational materials. And we also employed the South Asian actors and actresses and use the storytelling approach in order to pass the key messages of the importance of participating in the cervical cancer screening test. And the main purpose of using multiple teaching and learning strategies is to enhance the South Asian women's understanding about the importance of the cancer screening and how to access such services. And also, in order to ensure that they are available for convenience to join our program, our team do our best in order to look for the venues which is the most convenient for them to attend, and also to schedule the talk which is they are available to attend as well. Now, here are some of the photos taken during the health talk. And you can see, with the support of various community centers, they can offer the venue for us. Some may be a bit spacious, but where the others may be a bit packed. But anyway, this is a good venue for those women together in order to attend the program. Now, we have also evaluated the outcomes of the multimedia educational program. In this project, more than 1,000 South Asian women participated in the program, and the results demonstrated that the effectiveness of the program in terms of the large proportions of the women have the better understanding about the importance of the cervical cancer screening utilizations, the understandings of where to go for receiving the cervical cancer screening services, and also the large proportions of them have the intention to undergo the cervical cancer screening. Now, apart from this multimedia educational program, we also developed a community health worker-led interventions in order to address the barriers of the communications and how to access cancer screening services among the South Asian women. Now, these interventions mainly consist of 2 parts. One is to train a group of South Asian women to be a community health worker. So after they receive the training and get a passing score. So their main roles are to provide the health information to their peer South Asian women, to help them to book an appointment for the screening test, and also to accompany them to go to the venues and to provide assistance in communicating with the healthcare providers. And in brief, the advantages of this community health worker-led intervention is to enhance the knowledge and awareness among those South Asian women on cancer screening, as well as to enhance their accessibility to cancer screening services. And we conducted a studies in order to evaluate the feasibility of the training program for the community health worker in terms of the recruitment and the retention rate, participant satisfaction with the program, as well as their levels of knowledge change regarding the cancer and cancer screening services, their self-efficacy and the competency in acting as the community health worker. And the result of this feasibility studies was positive in terms of their knowledge regarding the cancer and the screening test was increased, and they have also enhanced their self-efficacy and the competence in working as the community health workers, and they are highly satisfied with the program. So apart from those positive results, the participants also have provided us with the suggestions, and they suggested that the training it is good if the training programs have an additional practical sessions in the community, so that they can gain some actual experience to be the community health workers before they actually act on it. And we also implemented the community health worker-led multimedia interventions and test its effectiveness using the cluster RCT study. And we found that the cervical cancer screening utilization rate of the participants having received the interventions was more than 45% higher than those in the control group. And this result indicated that the community health worker-led multimedia interventions can effectively enhance the cervical cancer screening uptake among the South Asians. And moreover, the participants having received the interventions had a greater decrease in the perceived barriers of the undergoing cervical cancer screening after the interventions. And the results suggested that the self-efficacy of these interventions participants to undergo cervical cancer screening was increased by intervention participation. Now, although this community health worker-led multimedia program showed a positive effect on improving the uptake rate of the cervical cancer screening among the South Asian women, and this type of intervention may not be applicable to all types of cancer screening program-related interventions. And the colorectal cancer screening is one of the examples. Now, there are two reasons why it is not, 100% applicable to the colorectal cancer screening program. First, the target group of the colorectal cancer screening program is for the older adult, but the cervical cancer screening program mainly targeted women aged 25 to 65, and the majority of them are middle age. And second, the procedures of take part in the colorectal cancer screening is more complicated than the cervical cancer screening test, because in Hong Kong, the government promote the fecal occult blood test, and older adults are required to visit a family doctor first, who registered to join the government the colorectal cancer screening scheme, and they are expected to collect the stool sample at home by themselves, and then return the specimen to the assigned specimen collection box. And therefore, the tailor-made interventions need to be developed in order to have the better support for those older adults to participate in the colorectal cancer screening. And therefore, we have added the family support component in this intervention. Now, first of all, the South Asians with the medical professional background and experience act as the educator to provide the educations to the South Asians older adults and their family members. And then the CHW use the telephone follow-up and the guided assistance method in order to help the older adults undergo colorectal cancer screening. And we use the RCT test in order to assess the effectiveness of the family-based interventions. And we recruited a total of 320 participants and then divided them into the intervention group and the control group. And the results show that the colorectal cancer screening rate in the intervention group was significantly higher than those in the control group, 72% versus 7%. And moreover, more older adults in the intervention group were able to return the stool samples on their own. So in other words, throughout these interventions, more older adults are being empowered and they can participate in the CLC test by their own. Now, in addition to the different types of the interventions developed by us, so I have to say that we also need to collaborate with different community agencies throughout this process, including the non-government organizations such as the community centers, which provide a support program for the ethnic minorities, and the ethnic minorities associations, the healthcare providers who provide the screening services to the public, including the ethnic minorities, and the South Asian ethnic minorities who need to actively participate in our programs and also take part in the screening test, and also their family members in terms of their encouragement and also assistance throughout this process. So in other words, I have to emphasize that building and connecting the entire network is a very important part of the success of the overall program. Now, in order to share our experience of the impact program with others from different parts of the world, but also facing the similar problem, so we participated in WHO Western Pacific Challenge 2022. And we are very pleased to know that the impact program was recognized by the WHO Western Pacific Innovative Challenges as one of the innovative solutions for various health challenges in the Western Pacific region. So, and our experience of how to achieve the equitable access to the cancer screening services has also been published in the Lancet Regional Health Western Pacific Journal. So, if you are interested to know more about our experience, so feel free to refer these articles for the detail. Now, to sum up my presentations, first, understanding and address the actual health needs and the determinants of health among individuals are very essential in order to ensure the good health and well-being for all. And using the tailor-made and innovative approach is important in order to fill up the service gap in cancer care services. And collaborations of the different stakeholders are also the key in order to enhance the accessibility to cancer screening services and reduce the cancer health disparity. Now, actually, the impact we have also developed the website in order to provide more information about our development process and also the outcomes of the impact program. So, if you are interested, to know more about our impact program, so you can, access this website, or you can also screen this QR code for more information. Now, I have to say that this is the impact program is only one of the examples to reduce the cancer health disparity. And I believe that many healthcare professionals, including all of you, have been working wholeheartedly to promote health equity in cancer care. So I would like to take this opportunity to invite you, in order to submit a manuscript, to share your expertise and valuable experience in promoting the health equity in cancer care. And in fact, the Asia Pacific Journal of Oncology Nursing is now calling for special issues. The title is Promote the Health Equity in Cancer Care. And the deadline for the submissions is end of this month, 31st of December 2022. You still have time. So all of you are most welcome to submit a manuscript to share your knowledge and experience of promoting the health equity in cancer care. So here are the references for preparing these presentations. And that's all for my presentations. And thank you very much for your attention. And you are welcome to ask any questions, if any, related to my presentation topic. Thank you.
Thank you very much, Prof. Winnie, for such a valuable information on the impact program and its aim in reducing the cancer burden and also enhancing the quality of cancer care. And ladies and gentlemen, we will now open the floor for QA session. Please post your question in the Q&A window or the chat box, and we will address it. Thank you very much. Is there any questions? Prof, it's a very large program. I would like to congratulate you on this impact program. I just want to know about the effectiveness of the education program, especially we see that there's a lot of understanding, increase in understanding and awareness, and also uptake of the screening tests and so on after the research that has been done. But how about the effectiveness of the education program in the lower educated group and lower income group, Prof?
Yeah, thank you for your questions. Now, and actually, the design of this program is targeting the ethnic minorities in Hong Kong. And you are right. Actually, not all ethnic minorities are in the lower socioeconomical status. So, and in fact, so what we are designing is to address the actual needs of the society. Now, for those ethnic minorities who are able, to obtain the information and able to access the cancer screening service. So this is not our target group. So our target group is for those who are in the lower socio-economical status and with lower health literacy. So we need to be selected and to package it so that they have the better understanding about the cancer and the cancer screening services. And interestingly, throughout this program, so we found that some of them know what is cancer and screening, but they have some kind of the misconception. So, for example, they perceive the screening test is a diagnostic test. So, in other words, they will go for medical advice and receive the screening test when they have symptoms. And this is absolutely a very typical example of their misconceptions. And this should be done, all right, when they are asymptomatic. So we need, to clarify, this kind of the misconceptions throughout the education. And the other thing is, although they know this is important, but the most common insufficient knowledge is how to access the cancer, the screening services. Now, in fact, in Hong Kong, the government also promote the importance of the early detection of cancers through screening, and they also provide a subsidy for the cervical cancer screening. Now, however, and the cost of the cervical cancer screening vary from one institution to the others. So for this process, we also need to compare the price for those women and recommend them to access those institutions with the lowest price. So otherwise, this will be another barrier for them not to, go for it. So in other words, when we design the educational program for the ethnic minority women, we need to look into the actual needs and the barriers. Why not, going for the screening test?
Thank you very much, Prof. That was very informative. There's another question here from Eng. The question is, what was your biggest barrier and your best facilitator in rolling out your program?
Oh, this is a very, very important, very good questions. Now, actually, we have been involving in this program for about 8 years. To start from the research studies to identify, the needs, the uptake rate among the South Asian women. The South Asians. So I still remember, in the beginning of, our projects. So the most challenging thing is how to outreach those people that is hard to reach. So in the beginning, we thought that the community center which provide the support program is the golden place for us, in order to outreach those people that we really want to reach. But in fact, it's not. So because for those who join those program, this is a kind of the regular members. So once we approach several times, so we can see the members repeatedly. So that means this is only small portions of those people that we want to go. So the most important thing is we need to be more proactive and to outreach as many places as possible, and also to identify what is the place for them to gather regularly. So one of the facilitators, so that I would like to mention, is the social capital. That means I really need to rely on my friends and those colleagues in the ethnic minority communities. and they provide us with lots of tips and hints so that we can have better opportunities to outreach them as soon as possible. So this is the challenges and also the opportunity for us in order to develop and implement the program. And the other challenges, and of course, is the language barrier. It's not only for the South Asians themselves, it's also us as well. In particular, when we translate our educational informations into their language. Now, because their language is Urdu, Nepali, and also Hindi. So this kind of the language is not a common language in Hong Kong. So it is also a challenge for us in order to look for an appropriate translator in order to translate appropriately for their better understanding. So we have some lessons to learn, but because of this, so we can improve our translation and the educational materials in order to for those ethnic minorities.
Thank you, Prof. Thank you very much, Prof. Yeah, that's what we want to know, because some of it is a very big project, and we want to know what are the challenges that Prof has been facing. Thank you very much, Prof. Another thing is that it also involves a lot of collaboration from the NGO. It's sometimes very difficult also to get to get the healthcare workers to actually participate in these big programs such like this. So I just want to know what are the steps, or how to attract or empower the collaboration of these NGOs, the family members and the healthcare personnel, to come together to have this, to enhance this as a very successful program. Now, how do you do it?
Yes, another very good question, and thank you for asking this. Now, it takes times. It's really take times. So I still remember when we conducted the first study, so we took a long time in order to, like we call it, lock the door. All right, to approach individual organizations in order to let them know what about our projects and see whether they are interested and why it is so important, in order to outreach them, in the community. So there are some of the organizations have the common goal. They really would like to work with us, but others may not, because we do not understand each other. So I think the most challenging thing is in the beginning of our projects. But up till now, so we find it, it is easier for us, to collaborate with various kind of the stakeholders, because they already know us and they know what we have been doing. And sometimes they just, proactively approach us, for the collaboration as well. So actually, up till now, and I think more than 50 organizations work collaboratively with us, with different collaborations work. For example, help us to promote our program, provide the venues, or even though to help us to identify some of the appropriate educators in order to deliver the educations, as well as to identify some of the community health workers to support our projects. So it will take time to build our relationship. And once it is built up, so it is easier to expand further.
Thank you very much for the answer, because it actually needs, a lot of effort to empower these people to work with us. We want an excellent, successful project, Prof. I think we are already finishing. It's already 9 o'clock. Okay. Any more questions from the floor? Okay, if there's no more question from the floor, I would like to end the session and express our gratitude to Professor Winnie for such a valuable sharing. Thank you very much, Prof.
Okay, thank you. Thank you very much.
Thank you.